Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Faranak Kamangar, board-certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
Today is the Resident Takeover podcast. I'm so excited about this. We are joined by none other than our SF Derm Med students, now resident extraordinaires, Dr. Payton Smith and Dr. Chandler Johnson, and they are interviewing none other than Nick Brownstone, who we all know so well. He is the host of the Cutaneous Miscellaneous Dermatology Resident podcast. I am going to hop off because you don't want to hear from me. You want to hear all the insights from this group. So, Dr. Johnson, I'm going to pass it to you.
Thank you so much, Dr. Farah. I'm so excited for this podcast to have on Dr. Nick Brownstone. Honestly, I've been looking forward to doing this podcast ever since AAD when we were discussing your podcast. And we thought, what better way to ring in our intern year than to have you on, get all of your wisdom and knowledge, and figure out how we can prepare ourselves to do our PGY2 year as derm resident. So thank you, Dr. Brownstone, for being on.
Well, thank you so much for having me. I've been looking forward to this podcast as well, because I spent a couple years in the department at UCSF dermatology as a clinical research fellow, doing clinical trials, seeing patients, and I just love my time at UCSF, love the dermatology department there. So anybody who been at UCSF, which I know you guys have been, is a real friend to me. So really great to be on with you guys.
Absolutely. So we do have a whole list of questions for you, just because, we're so grateful to have matched dermatology. We have a whole podcast series done on the future of dermatology here with Dr. Farah about our journey to match day. And now we're kind of continuing on with this line of questions and sort of preparation on how to best prepare ourselves to be the best residents that we can be. So in terms of, preparing for dermatology residency, we know you're the absolute expert on this, right? Based on your own podcast. So the first question for us is, this may be a little bit nerdy, but we're wondering how and when to start studying for residency. Should we be doing this? What do you think, Nick?
Well, yeah, that's a great question. And first of all, congratulations to you and everyone who's matched into dermatology. It's such an incredible accomplishment. Year in and year out, it's like the most competitive specialty to match into. And everyone who's listening who has not matched, don't worry, don't give up. I mean, you will get there eventually. It may take a little bit of extra years or extra time, but if you really want to get there, you will get there. So do not be discouraged. I mean, I've done 9 years after medical school. I was a plastics resident for a couple of years. I switched to derm, did some derm research fellowships. Now I've done 3 years of residency. So 9 years, I'm PGY 9 right now, but let me tell you, it was so worth it to do dermatology. So everyone out there, if it's an extra year or two compared to me, that's nothing. Yeah, dermatology is hands down the best field. Of course, I'm a little bit biased. And you guys are already ahead of the curve now by just asking about, what can I do in my intern year, my PGY 1 year to prepare for dermatology residency. We definitely can talk a lot about that. I'm just going to sum up for you in about 2 seconds. It's just don't worry, have fun. Okay, podcast over. No, just kidding. So the way to approach this is to really don't worry about dermatology residency quite yet. Like focus on just being a good doctor and learning how to be a doctor in a hospital. There's so many times that I think back to my intern year or stuff I learned as an intern that I wish I knew better now, because dermatology is fundamentally, medical specialty. And I always tell residents and medical students, you're a doctor first and a dermatologist second. Okay. We have to learn how to practice medicine, the fundamentals of medicine, performing good patient care, and having good communication skills. Like these are fundamentals in any medical field. And there's many patients that I had as a dermatologist where I said, you know what, I wish I knew more about this, or I studied this more in intern year, because again, it's the fundamentals of dermatology. For example, just today, I had an ICU patient that had a beautiful case of vasculopathy. And it turns out the patient was septic and was in DIC. And, of course, we all had ICU patients like that and learned that in our intern year. But I kind of wish I, studied a little bit more, knew a little bit more about that and make the consult maybe go a little bit easier. So definitely the first thing is don't worry about dermatology yet. Just learn to be a good doctor, learn to operate well in a hospital, learn good communication skills, learn fundamentals of good patient care. And that's definitely step one.
I was really expecting you to say something about like the dermatology Anki or something like that, but that's honestly a relief because I hate Anki. So thank you for saying that.
Of course, when you start dermatology residency, it's like you're starting medical school all over again. There's so much information. 3,000 diseases in dermatology that we have to learn according to the American Academy, plus pathology, plus pediatric dermatology, plus dermatopathology, plus statistics, epidemiology, basic science of the skin. People do whole PhDs in this field. So there's so much to learn. In my opinion, you could start studying dermatology during your intern year, but it's just kind of hard. I mean, I try to do it myself. Without doing it every day and doing the didactics and someone holding you accountable, it's kind of hard to start studying dermatology as an intern, which is why I say really focus on learning to be a good doctor and learning all the great principles of intern year. And you'll see when you become a dermatology resident, start to study dermatology, if you studied hard during intern year and learned about cancer biology, cancer principles, all the malignancies that you might see, just some basic physiology. There's so many medical diseases in dermatology where there's underlying conditions, right? Or, for example, paraneoplastic pemphigus, all the cancers associated with that. You may be a dermatologist and have a patient come in with paraneoplastic pemphigus, and you may be the first one to diagnose their malignancy because no one else has yet. Again, intern year medicine and intern year will serve you really well in those situations. So that's kind of what I think about that. Are you guys planning on studying dermatology, or do you have questions about that, or what was your plan going in?
I do, but I have a quick question just to jump in. We're discussing intern years. I'm just curious if you personally have an opinion on, preference of intern year, be it like transitional year or medicine year or pediatric year. Like, do you think one intern year may prepare you better for a dermatology residency? Because I know there's a lot of different options that listeners may or may not be aware of, but do you have any insight into that?
Yeah, it's a really great question. You can really do any intern year. It doesn't really matter. But personally, I probably think a medicine intern year is probably the best way to prepare for dermatology residency because most of dermatology residency is medical dermatology. Most of the field of dermatology is medical dermatology. So it's really good to have a good background on it. I did a surgical intern year, plastic surgical intern year, which was good. I definitely learned how to work hard, take care of sick patients. But if you're maybe a little bit more surgically inclined and maybe you want to do Mohs or surgical dermatology, I don't think you're going to get too much out of that intern year besides maybe learning how to suture a little bit more. Because the fact of the matter is, no matter if you're a peds intern, a surgery intern, a medicine intern, you're doing the basic duties of an intern, which is the same across any internship that you do. It's going to be on call, the first call for admissions, the first call to the bedside for a surgical issue, the person doing the post-op check, the person seeing the admission in the ER. So you're going to get that across most intern years. But medicine, you'll obviously be a little bit more medicine focused. You'll see physiology, you'll see malignancies, cancers, you'll take care of primary care issues. Surgery, you're doing some of those things too, but more suturing and maybe a little bit more sicker patients in the ICU, surgical trauma burn ICU. Pediatrics would be a great idea too. If you want to maybe go towards pediatric derm route, but sometimes you may not know that. But the bottom line is whatever derm that you're going to want to do and you're going to learn, you learn it in residency. And personally, I think, medicine intern year is probably the best thing you could do to prepare for residency. On our board exam for dermatology, it's 55% medical dermatology, 15% pediatric, 15% pathology, and 15% surgical/cosmetic. So the bulk of what you're doing as a resident is medical dermatology.
Awesome. Wow. Thank you.
So to follow up on your question, our plan, or at least my plan, I'll say that, for studying or preparing myself for dermatology is a big ask because I haven't started yet. I'm mostly trying to figure out what is a intern boot camp and how I'm going to survive working 6 days a week for the next 6 months. But if you have any recommendations, I mean, it sounds like you think we should just kind of focus on intern year, which is a big relief. Chandler, hopefully you had a better plan than I did.
I don't know about that. I'm just honestly trying to get a game plan going just because I like to be regimented. I love having a plan of action for success. You know, we all have step 3 as interns to complete. But looking forward, I would love to get, up to date a little bit more on my derm knowledge because there has been a little bit of atrophy in the months since all of my AIs and my away rotations. And I just want to show up on day 1 prepared, or at least as prepared as I can be. So the AIs aren't outshining me as a PGY2 in a couple of years. But my plan tentatively is at least returning to the Anki that we do hate but we do love. Maybe returning to some of the AAD modules, getting up to date on my my basic clinical knowledge through my transitional year that I'm doing. But it's very nebulous, and that's why I really wanted to reach out to you, Nick, because I know you can give us a lot of insight.
Right. Yeah, so we can definitely talk about if you're super type A preparing for dermatology residency during intern year, the whole reason why you brought me on, right? And again, my advice is just don't worry about it. Learn to be a good doctor, learn to be a good intern, learn the basics of medicine, patient care, communication with patients and with other doctors in the hospital, because the dermatologist, pretty much works with every single kind of doctor. They're really the general practitioner and the last of the true general practitioners. They do everything in medicine: cosmetic, surgery, path, peds, inflammatory, autoimmune, et cetera, and they talk to pretty much every other specialty as well in the house of medicine. But there's definitely some things you can do. Okay, we'll talk about that a little bit of how you can specifically prepare for dermatology residency. One thing I'd recommend is Andrew's Atlas of Skin Disease. It just came out with a new edition like a year or two ago, maybe. This has over like 3,000 photos of skin disease, and an atlas that we use as dermatology residents. So it might be a good idea, easy at night or when you're tired on an overnight shift, to just thumb through this atlas, and you're going to start to get some basic morphology down. And I think when you start residency, you might be able to pick up a few diagnoses that maybe you never knew before, never heard about, but you saw in the atlas, and you could just get that pattern recognition. A lot of dermatology is pattern recognition, right? It's a very visual field. So that could be an easy kind of fun thing to do. Go through that a couple of times, just looking at photos, okay? And some things that you find interesting and not heard of before, you could look up or read a little bit more about. You could do Anki, but I would really save that for residency because you're going to be tested on these things and asked about them in didactics. That's the time that you really want to take the Anki out, drill those facts down, get those mutations down, get those really minute details down at that time. It might be a good idea as well to start reading about some of the common things that you're going to see, right? I would not jump to like pancreatic paniculitis. There's only been 50 cases described in the history of the world. I did see one when I was in residency, or benign cephalic histiocytosis. I also saw one of those. That's, again, only like 50 cases ever described in the history of the world, But focus on things you're going to see all day long in any busy dermatology clinic, like atopic dermatitis, like psoriasis, like seborrheic dermatitis, like dermatofibromas, what else? Hidradenitis suppurativa. Those things might be good to look at. Get familiar with some of the medications, some of the basic treatment plans, some of the diagnostic tests, how it might look on pathology. That could be a very good use of your time as well, because that's the stuff, you're going to be seeing all day long.
That's awesome. And I guess a follow-up question to that, it sounds like the Andrews Atlas is a great resource for photos. So something in med school that I'm sure everyone learns probably the hard way, or at least I learned the hard way, is doing questions is probably a very good way to study, at least maybe once you start dermatology residency. But so I'm wondering, what is y'all's main source of practice questions for dermatology? Where do you get those from?
Yeah, it's a good question. Yeah. One thing I'll mention too is I really like the Baby Bologna book. I mean, I wouldn't really touch the main Bologna book. There's so much, even for a dermatology resident, chief resident, it's still kind of hard to read. It's jam-packed with information down to the most minute details. But Baby Bologna is pretty good too. It's a little more high-yield chapters. Might be good to look at a couple of those on psoriasis, atopic derm, like we discussed in your intern year. In terms of resources for residency, people usually read Andrews or Bologna. I think some people will read Bologna throughout their couple of years, maybe read Andrews at the end of their chief year, maybe. Those are the two main textbooks. For pathology, It's Dirk Elston's book. I would not think about pathology at all during your intern year. I still get scared by pathology, so don't worry about that yet. Question banks, like you asked. So there is Derm Q Bank. It's kind of like UWorld. There's thousands of questions and written by dermatology residents, and they're kind of vetted by board certified dermatologists. I was a resident editor, so I wrote some questions. There's the AAD Boards Prep Plus. That is kind of reserved for more of the applied exam, the real board exam. That's a question bank with over like 2,000 questions produced and written by the AAD. So those are really good resources too. Our board review Bible is the Ali Khan Review of Dermatology book. I'm sure you've been familiar with that. Take a look at that too. If you want to an intern year, it's, again, like if you memorize that, then you'll ace all of your exams. And I pretty much tried my best to memorize it. No one can achieve that, but it definitely helped me a lot by just reviewing that, nailing those facts down in my mind. So those are some of the key resources that we use as dermatology residents. So there's a lot out there, which is good. The most important thing is repetition, because that's how adult learning happens, right? You just got to keep reviewing it, review Anki, read a book, do a practice question over and over and over again. And then obviously in clinic, your knowledge will be reinforced. I mean, there's two really main things in residency, like to be a dermatologist, is like making diagnoses in clinic, doing well in clinic, and also reading about all this stuff and taking exams, because there's a lot of rare stuff you don't see in clinic too often, but you have to know them for the boards. And they're kind of like related, obviously, but they are kind of separate skill sets.
Mm-hmm. Yeah, that's what I heard from a lot of the residents at Downstate, is like there's a bit of a dichotomy. It's like what you see in clinic, bread and butter, mostly, and then what you study for the boards is like, you'll probably never see this, but you need to know about it just in case.
Right, exactly. And I'm going to give you the secret of dermatology right now, okay? You guys are like, your ears are perked up. Okay, here's the secret of dermatology, okay? It's recognizing an uncommon presentation of a common disease, okay? And it's especially very hard for like a resident or new dermatologist because they don't have that base rate neglect. They don't have the experience, right? So a lot of times things come in and you start to make these rare diagnoses, like 1 in a million diagnoses. But guess what? Like, what's the chance of 1 in a million diagnoses going to walk into your office? Well, 1 in a million, right? The thing that makes dermatology so difficult is that they show you a couple of pictures of psoriasis in the textbook, but psoriasis really look like 100 different ways on the skin, and there's so many variants. There's rupioid psoriasis, there's ostracis psoriasis, there's annular pustular psoriasis, there's acrodermatitis cutaneous of Halipo, there's guttate psoriasis, and so on and so forth. That's what makes dermatology hard. It's not like, okay, you have your A1C is up, you have diabetes, we'll give you a medication. Like it's not that clear sometimes, and it gets even more difficult when there's a difficult case, and a lot of dermatologists will biopsy and just believe the path blindly. And a mistake I see a lot, especially in new grads, they think the biopsy is the answer key, and they're not really performing a CPC, a clinical pathological correlation. That's an important point, another secret of dermatology as well. So again, that's where morphology is so important, distribution is so important, and that Andrews Atlas, if you go through that like 2 times, look at those 3,000 images, you're already going to have a big leg up. Easy to do, fun to do, and not too taxing.
That sounds great. It also sounds very daunting. There's a lot to learn, especially from, sitting where I am right now as a future dermatology resident. But thankfully, you provided us with some amazing resources that we will be studying soon, Payton.
Well, I'm just so excited about our next question, which is how, when, and where to network. So, probably now we're not going to have a ton of time for networking, but as we know, matching is a lot of networking. It's not all networking, but it's certainly a big part. So would you say that there's time for any networking with your residency program or your future co-residents or even industry? Like, what would you recommend for your intern year?
Yep. Yeah. Networking is super important in medicine and in dermatology. Dermatology is a relatively small field, which is great because everyone's friends. And everyone who does dermatology just loves dermatology. We all love doing it. It's the best field. I mean, I go to dermatology conferences and they get up on stage and they say, "Isn't it great to be a dermatologist?" And everyone claps and cheers. I mean, you just don't see that in many other spaces. So networking is very important and everyone loves to do it. And we're all friends in dermatology. So conferences are huge for networking. Try to get to a couple, maybe even 1 or 2 during your intern year for dermatology to start meeting people. And it's a little bit awkward at first, but at the receptions, during the breaks, at the exhibits. Just go up to people and say, I see you're from this program or this place here. My name is Payton. My name is Chandler. Great to meet you. I'm going to be a resident, where are you working, and chat a little bit, see if there's a connection, and then say, I'd love to follow up. That's a really, really important thing to do. And guess what? Everybody you talk to is going to be super receptive, because I did this myself, started years ago doing this. And then if you see talks, don't be afraid to email the person. Hey, loved your talk. Would love to connect and learn more about what you do. I guarantee you they'll be so receptive to that. And people reach out to me, and it's an honor. We all love helping out dermatologists and dermatology residents. So, I would try to make it to 1 or 2 conferences if you can with your intern year, and just start meeting people because there's so many opportunities in the field, and it's just good to get started early and know what you want to do as a dermatologist, because we all love seeing patients. But the great thing about dermatology is everything else you can do: leadership roles, working with pharma companies, speaking, consulting, starting a skincare line, opening up derm practices, teaching medical students. There's so many opportunities. So it's good to get started, and variety is the spice of life. So you can definitely take good care of patients, but also enjoy everything else that dermatology has to offer.
And maybe even come to the San Francisco Derm Society, right, Chandler?
Yes, we'll be there.
Yeah, June 6th through the 9th. Great place for conferencing, very small, but not too small. Lots of opportunities for networking. So we'll be there. Dr. Brownstone, are you by chance free at that time, or you got something going on?
Or will you be in Spain?
I'm going to be I think I'll be in Spain having some vino and some jamon, or having a siesta. Yeah. So otherwise I would be there.
That's
the only excuse. I wish I was in Spain, actually.
But Dr. Brownstone, you've been mentioning, so many different opportunities for involvement within dermatology, so many areas of expertise that different clinicians have. A lot of residents that are entering into dermatology residency may be curious about honing their niche within the field. I know all 3 of us have an interest in psoriasis in particular. But for those who may be trying to delve into other areas or have certain disease pathologies or concepts in mind that they want to pursue, how do you recommend a resident pursue those different avenues within dermatology?
Yeah, that's a really good question too. A lot of people ask me, how do I find my niche? It's hard to answer. A lot of people say, chase your passions, but really in dermatology and in life, your passions will kind of find you. Don't worry about it too much. Just learn the basics of dermatology. And as time goes on, you're going to gravitate to what you're good at and what you like. It's just very natural, and a lot of stuff is driven by your mentors as well. Who your mentors were early on, who your mentors are in residency, kind of what they're doing. You're going to kind of follow suit, because they're going to be ones that they're going to advocate for you and give you opportunities in that field. So I wouldn't worry about finding your niche too much. It'll come eventually, and you'll know it, because you'll gravitate to what you're good at and what you like to do. It's a natural process. You don't really have to do much active work there. And again, a lot of it's mentor driven, because that's who you're working with, who knows you the best, you're working closely with. And the good thing about dermatology is whatever you do in dermatology is amazing. Mohs surgery, pediatric derm, general derm, medical derm. It's all amazing. So much opportunity. So much is needed in all of those fields that no matter what you choose, you're really, really going to enjoy it, and it's going to be awesome. So I would not worry about that at all.
That's great to hear.
Yes, agree, Payton.
All right. Well, do we have any closing questions, Chandler?
So I guess just piggybacking off of the discussion that we were just having, Dr. Brownstone, what are you passionate about in dermatology? I know that you have a very exciting position that you're about to start this summer.
Right. Yeah, no, I love doing dermatology, and I'm involved in a lot of things, but I really just love doing it. So it's fun for me. I liked plastic surgery, but I love dermatology. So this is definitely the spot for me. I love teaching. I love learning. We have to be lifelong learners in dermatology, but especially love teaching. I took over 12,000 photos in residency. So if any resident out there has taken more than me, let me know. I think I definitely going to win that prize. And through through my podcast. I started a podcast years ago, Cutaneous Miscellaneous, the Dermatology Residency podcast that I've gotten a lot of great feedback about, and just love teaching my dermatology resident colleagues about advice they don't get in residency, and some board review from some of the leading KOLs in the country. That's been a lot of fun too. Just figuring out, what trips me up or what I want to know more about, and deliver those lessons to our dermatology colleagues, because you learn so much in residency when you're done. You learn how to diagnose rashes, cut out skin cancers, address cosmetic concerns. But what you don't learn is things like, well, God forbid, what if I get sued? Or what insurances do I need? Or how do I manage all this money I'm going to be making? How do I make smart investments? Things like that. How do I give a good presentation? How to start a practice? How to run a practice? Like, no one teaches us those things. And when you get out, it's going to be good to have a jump start on these complicated topics. So once you're done, so yeah, really educating and just doing dermatology is a big passion of mine.
100%. And Mount Sinai is going to be lucky to have you this summer. Congrats.
Thank you. Thank you. Yeah, I'm really excited to start there. There's so much great dermatology at Mount Sinai, as there is at UCSF too. Just tons of research, tons of trials, huge department with pretty much anything you want to do in dermatology there. So I'm very lucky to join them as well.
We have to finish with what you're excited about the future in dermatology. So Chandler, what are you excited about in the future of dermatology?
Oh my goodness. Well, honestly, I'm still riding the high of match day. So I'm very excited to become a resident who is pursuing dermatology, going to become a future dermatologist, hopefully a educator like Dr. Brownstone is as well. And of course, our queen, Dr. Faranak Kamangar, who is the host of the Future of Dermatology podcast. So very much so looking forward to educating and being a part of the future generation of dermatologists.
Yeah, I mean, I just want to end with a few closing thoughts. Congratulations again, guys, and to everyone who's matched in dermatology. It's definitely a long road, though, and I know match is so stressful. Intern is going to be stressful. Residency is going to be stressful. Like, the stress never really ends, okay? It does get better as time goes on, though. You make more money. You get promoted. You get to call the shots. You get to teach. You get to speak at these conferences, right? So it does get better, but the stress is really never get better, because life is just stressful and work is stressful. That there's no getting around that. So it's just important to always enjoy your life and enjoy the journey, because I'm a big believer in the destination is not worth it unless you enjoy the journey. And time goes fast, especially in residency when you're seeing patients every day, studying derm. There's so much to study. The time will pass quickly. So just make sure to enjoy your life. And a couple of lessons that I kind of saw as a resident that I think I can just give to everybody. And I mean, I'm a little bit older than you guys, but I'm not too old. I don't have, that much life experience, but I do have a lot of life experience. Okay. Just talking about compared to my mentors who are older, but I do a lot of worrying, and I think we all do in residency, about, am I going to do bad in this exam? I have a presentation coming up. I don't know if I took the best care of that patient. I might have missed something. And then, a lot of stuff that we worry about never actually comes to fruition. Okay. So just do less worrying. And I just realized that a lot of things I worried about in residency, I never had to worry about them in the first place because they never came true. Okay. So we all worry too much. We need to do a little bit less worrying. And also, there's going to be hard times in residency. Maybe you're fighting with your partner, or you were getting crushed on consults, or you got a big presentation coming up you're nervous about in front of the whole department, And I just realized throughout these past few years in residency that it's always darkest before the dawn, and things are always bad before they get better, but things will get better as they usually do. Just have a positive attitude, keep working the problem, stay positive, and things will get better. And I've certainly been there, and things have certainly worked out well in the long run. So just a couple of things I learned and saw firsthand through residency that I want to pass along to you and everyone else starting. Just some life lessons.
Thank you so much. All righty. Well, I think that is a wrap on the podcast. Thank you so much for being here, Dr. Brownstone, and can't wait to hear more from you in the future.
Thank you for having me.
Thank you so much.
Thank you. The future of dermatology is very bright.
Yes.
Yeah. Bye. Thank you.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.